Good morning. This is Mike Berkeley, the founder and director of the Berkeley Center for Reproductive Wellness here in New York City. It's Saturday morning, and yes, I'm up way too early. Hopefully, you're watching this in the afternoon and not as early as 10:38 a.m. on a Saturday morning. So, this video is meant for those who are faced with fertility challenges. And previously, I've made videos talking about specific pathologies and how acupuncture and herbal medicine can be utilized to help uh, mitigate those pathologies to improve pregnancy outcomes. Things like polycystic ovarian syndrome, poor egg quality, endometriosis, male factor, these kinds of things. But today, I'm not going to be talking about any pathologies at all. I'm going to be taking a little bit of a different track here. So I'm really going to ask you some questions and give you some things to think about, if you will. So you've done 3 failed IUIs, and you've done 3 failed IVF with embryo transfer with your own eggs, and perhaps even you've done 1 or 2 donor transfers, donor egg transfers, to no avail. And so what I want to ask you is this. Do you think that Western reproductive medicine is the only medicine extant that can be utilized to treat those with fertility challenges? Now, obviously, intrauterine insemination and in vitro fertilization are excellent models of intervention that have proved repeatedly to be effective. The proof is in the pudding. There have been millions of babies born as a result of IUIs and IVFs. However, there have been, multitudinous tens of thousands of IUIs and IVFs that have not worked. Even with a presumed good lining, and even with a chromosomally normal, beautiful looking embryo. So what's going on? So I'm not sure, and there's no reproductive endocrinologist that's sure, but I'll tell you what I think. I think that there's more to egg quality than is currently diagnosable using our current knowledge and diagnostic equipment. In other words, 10 years from now, we'll have a better window into the diagnosis of infertility. We really can't determine what a good egg is. We can determine what a bad embryo is. We can't even really determine what a good embryo is. For example, you transfer a beautiful embryo that's chromosomally normal and it doesn't work and the lining is good. So there must be something wrong with the embryo that is undetectable based upon Western scientific / medical diagnostic approaches. Of course, the endometrium plays a very large role in the ability to conceive or the inability to conceive, and obviously so too does sperm. And so what I want to put to you for your consideration is that you may want to think about including a modality of intervention, which is traditional Chinese medicine, which encompasses, at least in the context of fertility enhancement, acupuncture and herbal medicine, as part of your IUI and or IVF protocols, because we have seen over 2,000 years beneficial effects in that cohort of individuals who have fertility challenges, and we've certainly seen over the last 20 or so years the benefit of utilizing acupuncture and herbal medicine in conjunction with IUIs and or IVFs. Why? How? Well, I'll give you an example. I've had many patients that have done failed IUIs, many IUIs, 5, 6 IUIs, and many failed IVFs, and I've treated them for 3 months, and then they've conceived on their own, or they've conceived with the subsequent IVF. Now, you might say, well, maybe it was the subsequent IVF that got them pregnant and had nothing to do with the acupuncture and herbs. And I would say to you, perhaps you're right. We don't know. But what we do know is that acupuncture improves blood flow to the lining. It improves blood flow to the embryos, the follicles, and the eggs. It improves excretion of dead cells from the uterus, from the ovaries and the follicles. And we know that it improves endometrial function, endometrial health. It improves egg quality. There are many tests and studies that can attest to this. I'll leave it to you to do your own Google research. But really, this is a message about doing the same thing over and over again and expecting a different result is not the position that you want to find yourself in. So I'm asking you to think about this and to consider employing acupuncture and herbal medicine in your reproductive journey, if you will. If you'd like to speak to me, if you have questions, I'm happy to take your questions. You don't have to become my patient. I'm just happy to answer your questions. If you'd like to become a patient, I'd be happy to treat you. My phone number is 212-685-0985. And our website is berkleycenter.com, which is Berkley center.com. I'm wishing you Godspeed on your journey to family, and I invite you to the Berkley Center to find out how we can help you to achieve your dream of family. Wishing you the best and happiest of weekends and health and safety. Take care.